Yo, what's good? We're back with chapter 7 of the Cognitive Behavioral Theory book, the book going through sort of the different ways to deal with your anxiety, different things you can do. So we're on chapter 7, Cognitive Behavioral Theory and Depression. Depression is a major mood disorder that affects millions of people. It causes a continual feeling of unhappiness, lack of interest, and indifference to activities. Usually referred to as clinical depression or major depressive disorder, depression is quite a big deal because it actually leads to suicide in some cases. Depression affects the way you think, how you feel and behave. It often results in varying emotional and physical problems. At its full-blown stage, depression also affects functioning and interferes with day-to-day activities. Many people think of depression as something you can simply snap out of, but this isn't true. Depression requires treatment in the long term, and one such effective treatment for depression is cognitive behavioral therapy. When combined with medication, psychotherapy treats depression even faster and better. I have seen so many people mistake depression for sadness, just like anxiety is confused with fear. Sadness and depression are two different things. The main difference here is sadness is a short-term feeling, while depression is persistent. For instance, if you lose someone close to you or you lose your job, you don't feel depressed. The normal emotion you would respond with in that situation is sadness or grief. The experience of loss sometimes causes people to refer to themselves as being depressed. But that is not depression. Grief or sadness is a natural emotion, one of the most basic human emotions. In fact. However, depression is a disorder. It is not normal or natural. Intense sadness is simply one of the symptoms of depression. Grief also shares that similar symptom. However, in some cases, losing a loved one or your job can result in major feelings of depression. Therefore, grief and depression sometimes overlap. Like I said, depression is a common disorder. According to data, about 7% of the total population of the United States experiences depression every year. And as a female, you are more likely to develop depression than your male counterparts. There are different types of depression, but about 14.8 million US adults are affected by major depressive disorder, based on stats released by the Anxiety and Depression Association of America. Sometimes a particular depression type occurs alone in an individual, while some occur together with addiction. Cognitive behavioral therapy can be effective for both depression and addiction. It revitalizes you and rejuvenates your interest in the activities you love, while helping you overcome addiction. Before we go into CBT interventions for depression in depth, let's talk more about the types of depression. Major depressive disorder entails having depressive symptoms for no less than 2 weeks. This means when you get symptoms of depression and they remain persistent for at least 2 weeks, you are suffering from major depressive disorder. A single episode of major depression can be so disabling. It messes with your ability to work, eat, and even sleep. Normally, episodes of major depression only happen a few times in an individual's life. They sometimes happen after a major traumatic experience, such as the loss of a loved one. Another type of depression is persistent depressive disorder, formerly referred to as dysthymia. PDD is also called, has symptoms that continue for at least 2 years. The difference is the symptoms are usually less intense than those experienced in major depressive disorder, but they are usually the same symptoms in general. In many cases, PDD manifests as stress, severe irritability, and an inability to enjoy yourself or life as a whole. Finally, we have bipolar disorder, which is a major mental disorder. It is also a form of depression, but it often involves maniacal behavior. It manifests as a major mood-shifting experience, usually involving mild or extreme highs and terribly depressive lows. Despite extensive research, experts do not yet know what exactly is behind depression. However, they have been able to identify a range of factors that can cause or enable depression. These factors vary from biological to environmental. If you have a family with a history of depression, it makes you susceptible to symptoms of depression. Some medical conditions like sleep disorders and chronic illness may also make you experience symptoms of depression. Substance abuse is another thing that may result in depression. As you can see, depression and anxiety share some similarities based on the factors that cause both. We will come to understand the link between anxiety and depression as we progress. Stress, trauma, low self-esteem, medication, and grief are some other factors that can make you experience symptoms of depression. But apart from these factors, here are some causes of depression that have been identified by the experts. Genetics. Depression has been linked to genetics following a variety of studies involving family, twins, and adoption. Although studies attest that a strong genetic component does exist in the experience of depression, it is not yet certain if genetics is a risk factor for depression. The exact gene that causes depression and different mood disorders is still unknown, but it is known that different genes play a part. Chemistry imbalance. An imbalance in the neurotransmitters responsible for mood regulation has been recognized as a possible biological cause of depression. These neurotransmitters include serotonin, dopamine, and norepinephrine, all of which contribute to mood. As brain chemicals, neurotransmitters play a major role in helping different parts of the brain communicate with one another. However, when neurotransmitters become short in supply, it results in the symptoms of major depressive disorder. This theory is not fully accepted by experts though, because it remains unproven. Researchers believe the theory does not explain the many risk factors that contribute to depression. So, some medications for depression often concentrate on changing the levels of some chemicals in the brain. Other risk factors can contribute to the development of depression in an individual, and some of them cannot be changed. They include gender and family history. Others, such as stress levels and diet, can be altered. Let's move on to the intervention practices for depression in CBT. CBT intervention practices for depression. Cognitive behavioral therapy is a combination of cognitive therapy and behavioral therapy. So, when treating depression with CBT, cognitive practices are used to address thoughts, while behavioral practices are used to address moods and actions. To get the most out of CBT for depression, it is sometimes combined with medication, depending on what you want as the patient. CBT is especially effective when depression is at a mild or moderate state. However, it can be just as effective in severe cases if your therapist is really skilled and you stay dedicated to the process. Your therapist will help you identify possible negative thoughts that may be contributing to the development of depressive symptoms. These thoughts are normally linked to anxiety. For instance, if you think that you have no value in life, you may become depressed as a result of this. You work together with your therapist to identify the presence of these thoughts. Once you recognize them, you learn to replace them with positive thoughts. Automatically, the change in mindset leads to a change in behavior, and this eases the symptoms of depression. This may sound easy, but in reality, it's much more complicated. You must be ready to put in months of work, and you must be ready to work actively with your therapist. Remember that CBT is a combination of different cognitive and behavioral therapies, so the intervention used for treating anxiety won't be the same as for depression. While CBT uses exposure to fear to help anxiety patients, CBT for depression attempts to change thought patterns directly. During therapy, you will work with your licensed therapist to understand how your thoughts are affecting your feelings and actions. You will also work on understanding how actions affect thoughts and feelings. Treatment will help you develop a balanced, healthy, and more constructive way of dealing with negative thoughts. This will rid you of the behaviors that stem from your depressive state or the depression itself. The whole therapy will be present-oriented, focusing on your current state of mind rather than trying to understand things that happened in the past. The decision to go for CBT to treat your depression is a big one, and you may at first find everything overwhelming and daunting. However, you have nothing to fear, because I will be telling you exactly what to expect in your sessions. Firstly, the therapy sessions may take place at least 5 times a week. Each therapy session will likely last between 30 and 60 minutes, but this will all depend on the agreement you have with your therapist. In the first few sessions, your therapist will try to evaluate if you are suitable for the therapy and if you feel comfortable with it. This is to make you comfortable and ensure you will really work together with your therapist to make the therapy as seamless as possible. Your therapist will quiz you on your past and the background to your depressive disorder. Yes, CBT is grounded in the present, but you may need to tell your therapist about your past so they can ascertain how it is contributing to the present. Once you have told your therapist about everything, you decide on your objective together with your therapist. You agree on where to start your treatment from. Your therapy will likely be adapted based on your personality and character. Different factors come to play. Reflective reframing. Reflective reframing is a technique used for depression treatment in CBT. As the phrase suggests, it involves 2 steps, which are to reflect and then reframe. Reflective reframing is when your therapist gives you the opportunity to talk about your depression, both factually and emotionally. The way you explain yourself is what gives your therapist insight into how you think and feel about yourself. Your therapist will discover that you do one of these 3. Generalize negative experiences, internalize negative experiences, or stabilize negative experiences. When you generalize negative experiences, it means you apply the outcome of a specific event to everything else. Internalizing negative experiences means attributing the outcome of a situation completely to yourself. You don't pay attention to possible external causes. Stabilizing negative experiences means seeing negativity as a permanent state for yourself. I'm going to go through that paragraph again just one more time. When you generalize negative experiences, it means you apply the outcome of a specific event to everything else. Internalizing negative experiences means attributing the outcome of a situation completely to yourself. You don't pay attention to possible external causes. Stabilizing negative experiences means seeing negativity as a permanent state for yourself. Then your therapist will attempt to help you put on a new frame, that is reframing. After reflection, reframing is done to help you find healthier ways of interpreting the things that happen to you. Without learning how to reframe, you will find yourself unable to move on from negative experiences. In fact, you will likely get stuck in a repetitive cycle. One thing I want you to know is that CBT won't work for your depression unless you believe that it will. Recently, it has been said that CBT is not nearly as effective as it used to be for depression. And the reason for that is nothing else but the fact that many people think that CBT can't help them. If you go to therapy with the belief that it won't work, then it really won't work for you. Mindset plays an important role in accomplishing anything, and your therapy goals are not excluded. CBT will work effectively for you if you are motivated enough and you really want to change in life. You are capable of introspection. You understand the fact that you are the only one with the ability to control the things that happen around you. You are dedicated. You work on your assignments and also involve yourself fully in the sessions. Again, it will work if you really desire a change. Before I move on to talk about the other conditions that cognitive behavioral therapy can be used to treat, it is important that you understand how anxiety and depression are related and why they always occur concurrently. So we're going to cut it there. Next episode we're coming in with the link between anxiety and depression, chapter 7.1. Thank you all for watching. I should continue, but I won't. Thank you all for watching. Make sure you subscribe, and I'll see you next time.